So if you had foot, ankle, or leg surgery and that was supposed to fix the problem, yet you still have that pain, the problem still seems to be there and you're frustrated, what if I told you there's another way to help your body heal, even if you've had surgery, to get you back on the road to recovery? So again, what's the reason that you had the surgery, you were hopeful that your body was going to work, and you feel like it's let you down? It hasn't let you down. Oftentimes what's happened is just in that recovery process of surgery, your body got down the wrong healing pathway, or sometimes got just stuck in this cycle and it's just there and it hasn't healed. You've had too much scar tissue that's formed, and that's nothing you've done wrong. That's just the way your body is programmed. It's nothing that the surgeon did wrong. That's one of the unpredictable outcomes of surgery, is that you don't always get better. So one of the things that I like to use, whether it's before surgery, intraoperatively, or to help you get better after surgery maybe it didn't work as well as you wanted to, is something called PRP. So PRP stands for platelet-rich plasma. And platelet-rich plasma is concentrated growth factors and platelets that, again, when you've had surgery, those same platelets and growth factors in your body were directed down to that injured area from the surgery. But again, the one thing that was limiting it was blood flow. And oftentimes when we're cutting, and again, I'm a surgeon, when you're cutting through the tissue, getting down to that area of injury, even at the microscopic level, we're disrupting blood flow. And then as we sew things back up and repair things and put them in a position to heal, we're relying on the body to heal. And sometimes that blood flow just didn't restore as quickly as we wanted it to, or didn't happen at all. And so now you're in this injured state again, and you're frustrated because you're not healing, you're hurting. So what PRP does is we concentrate all those growth factors, those platelets that were supposed to help your body heal, because they're still in your body, they still work, and we put it right into that injured area. Sounds painful, and it can be, but oftentimes we will numb you up before we do that, so that we're able to specifically target and put that injured area under ultrasound, and then I can see exactly where it needs to go. There's another treatment that works. Oftentimes people refer to it as stem cell therapy, and it's called cell therapy. And so the two most common locations that we'll get those cells from is from yourself, and it comes either from your bone marrow or from fat cells. So like PRP, bone marrow and fat cells have all these same growth factors, plus some other important stem cells that stimulate even a faster and longer healing response, and are able to help improve the outcomes from surgery. Oftentimes, we're able to avoid surgery, or at least kick that can down the road in someone with severe arthritis, whether it's in a knee joint, an ankle joint, or any joint in general. As long as you're able to be active and not have a lot of pain, it doesn't matter what your x-ray looks like. It's how active you're able to be, and is your quality of life being affected. So again, if you're in that rut of I've had surgery, I'm hurting, and I don't know what to do, cell therapy, what we call regenerative medicine, because we're stimulating your body's ability to regenerate, is one of the things that we do to help your body heal. In combination with that, we'll add shockwave therapy to it. And shockwave therapy is ultrasonic sound wave. Again, you're not getting electrical shock, you're just getting, it's a sound wave that will stimulate damaged tissue to start to heal by improving blood flow at that microscopic level that I was talking about. So when we combine all these things together, that's that regenerative medicine approach, and we can help you get out of that rut that you seem to be in, where you're just not getting better. If you're not quite in that rut yet, or considering surgery, sometimes this is an even better option to help you heal without having surgery. Sometimes surgery is inevitable, it has to happen. If you broke a bone, it's got to get put back together. But even PRP can help that healing process from the injury around the bone, or any type of a severe injury, get you to heal. So if you found this video valuable, hit like and subscribe, and then drop a comment below. I'd love to be your resource for non-surgical options or post-surgical options to help your pain improve by using regenerative medicine. So come see me, Dr. Keith Bangart, at Restorative Edge Clinic.